Go ahead.
Okay. I'm here to talk to you guys about something called intermittent explosive disorder. This is a disorder characterized by extremely aggressive behavior that escalates to releasing of pent-up anger and someone or something like an object, releasing pent-up anger and either hitting something or someone like an animal or an inanimate object like the door. Many of the IED, which is intermittent explosive disorder, IED, symptoms like headaches, low frustration tolerance, and uncontrollable irritability have been displayed in many people in my family. And without knowing about IED, I would have never known that they may have a disorder that needs medical attention. In 2003, the National Institutes of Health found that roughly 11.7 to 16 million Americans are affected or have been affected by intermittent explosive disorder. So that's a lot of people. Imagine in 2003, if it's 16 million people, imagine now when we see everything on the media and stuff. From 2003, it's like more than 10 years ago. So imagine how many people now have IED. It's ridiculous. And we're going to discuss causes, symptoms, and treatments that are non-chemical for IED. There are three causes of IED: genetic factors, physical factors, and environmental factors. For genetic factors, passing from parent to child, a lot of people who have IED, their parents also had IED, so it's genetic. Physical factors are serotonin levels that have to do with happiness. So these are the serotonin pathways, and these levels actually functions with your mood, memory, processing, sleep, and cognition. So if your serotonin levels are off, your mood changes, your memory is off, a lot of things can happen to you. So this is actually involved with IED. Environmental factors, I think, are the most important ones, are upbringing and the lack of a positive role model. So a lot of people nowadays don't have positive role models, and that can affect people in the worst way. With IED especially, if someone is learning from someone else, how to be very explosive, not have very good control of their aggressiveness, then this can just also cause it. Some of the symptoms for IED are behavioral symptoms like road rage, angry outbursts, damaging property, physical and verbal aggressiveness. Physical symptoms are headaches, muscle tensions, tremors, feelings of pressure in your head. Cognitive symptoms are low frustration tolerance and unable to control your thoughts. And psychosocial symptoms are feelings of rage and uncontrollability. And when I say psycho, it's coming from the Greek word mind, not psycho, like somebody is crazy, because that's technically the derogatory term that people use with psycho. But it really doesn't mean psycho, it means it's talking about your mind. Yeah. So with some of the behavioral symptoms like road rage, you would never think that road rage, somebody would have something like a disorder or something would be wrong with somebody. The thing with these symptoms are taking it to the next level. So if somebody is upset, yes, people can get upset, but taking it to that next level and getting out of your car and beating somebody up because of road rage, that's IED. Or or having headaches because something is upsetting you, and you just keep thinking about it and thinking about it and thinking about it, and then you just end up hitting something or someone because you're so upset you need to release that anger. That's IED. Some of the psychotherapies that they have are exposure therapies, psychodynamic therapies, and pet therapy. There are two types of exposure therapies. One is they talk to somebody who has IED and they see what triggers them. So they give them a lot of triggers at one time, and it's just kind of emotionally draining them, and it has them act out, but in a safe environment. So then they know what triggers them and how they can fix that. Kind of desensitizes them, so they just do it so many times that it doesn't really upset them that much. So when they go outside, then they can actually take care of themselves and not go that far. Psychodynamic therapy. Oh, another exposure therapy is also small triggers over a long period of time. Also, the same thing. It does the same thing as desensitizing, but it's just not as much at one time. It's probably for people who have a lot more behavior. It's probably safer for them to give them little aggression triggers at one time, and instead of giving them such a big amount of them. Psychodynamic therapy sessions is discussing past events and why somebody is the way they are. So probably looking at either their family or people who were their role models back when they were either children or adolescents, in high school and stuff like that, people that they talk to and they consider their role models could be the reason why they are the way they are. So you talk about these things with them, and with that they get to learn on how or why they are the way they are, and then it helps them handle with frustration normally because they know why they are the way they are. And pet therapy has been known to help release stress in a lot of different mental illnesses. So with that, they use pet therapy also with people with IED, and it helps them a lot because they feel like when they're with a therapy dog, not exactly just other people's dogs or any other kind of dog, because those dogs might not be as docile. They need a dog that is docile, that's calm. So when they are kind of feeling like they need to be aggressive, they're with this dog and it's quiet, it's not barking, it's not doing anything, and it helps them relieve stress better. While taking into consideration everything we've discussed from causes of IED to treatment of IED, the first step to overcoming this disorder is to be truthful and talk about your feelings. I know a lot of men don't like to talk about their feelings, and that's probably why this disorder affects more men than women. An estimated 80% of those admitted in psychiatric services because of intermittent explosive disorder are men, according to the healthresearch.org. In conclusion, if you know anyone with these type of symptoms, they probably need someone to talk to. With so many therapy treatments that are available, there is no reason why someone should live with so much aggression in their lives. Stress is the leading cause of many illnesses, and if someone that stress is relieved, people could live longer and be happier. Jesse, can you do that? And so these are some of the pictures that you think about when you see IED. Somebody punching through a wall with a bloody fist. The Hulk, because he has that uncontrollable rage that nobody can stop him, and road rage. And some of the treatments are dog therapy, pet therapy. Usually they use dogs. And some of the treatments are also like putting the puzzles together when you think about the things that happened to your past. One more? Yay! I was sweating. Are you done? You stopped it, right? Please tell me to stop it.